Stop! You have been eating cranberries the wrong way your entire life. Welcome back to Moonlight Food, your strategic guide to the biological power hidden in your kitchen. Most people only think of cranberries as a sugary sauce for the holidays or a processed juice for urinary issues. But by consuming them drenched in refined sugar or ignoring their specific skin-bonding chemistry, you are neutralizing the most potent biological glue and anti-adhesion medicine in nature. To understand why the cranberry is a true survivalist superfood, we have to look at its rugged origins in the acidic bogs of North America. Indigenous cultures didn't just use them for food, they used them as a concentrated medicine to heal wounds and prevent infection. This is a berry built for battle, evolving a unique set of chemical weapons to survive in harsh, waterlogged environments. Weapons that can protect your body, from the microscopic level up. When we dive into the nutritional core of a cranberry, we find a profile that is uniquely aggressive against pathogens. While they are loaded with vitamin C and manganese, the real secret lies in a specific type of tannin called A-type proanthocyanins, PACs. Unlike the B-type found in most other fruits, these A-type PACs are specialized anti-stick molecules. They don't just kill bacteria, they act like a biological Teflon coating on your internal linings, preventing harmful bacteria like E. coli or H. pylori from latching onto your urinary tract or stomach walls. Furthermore, cranberries are one of the highest sources of quercetin and pionidin, two potent anti-inflammatory agents that protect your vascular system. When you eat a cranberry correctly, you are providing your body with a sophisticated defense shield that prevents infection before it even starts. The health benefits of this tart superfood extend from your bladder to your heart and teeth. The A-type PACs are famous for urinary health, but new research shows they do the same for your mouth, preventing plaque-forming bacteria from sticking to your teeth and gums. For your heart, the polyphenols in cranberries work to increase good HDL cholesterol and reduce arterial stiffness by improving the function of your blood vessel linings. Moreover, the uracilic acid found in cranberry skin has shown remarkable potential in reducing systemic inflammation and protecting the liver. It is a complete internal sanitization system that keeps your tissues clean and your inflammation levels low. However, the reason I told you that you are eating them wrong is due to the sugar trap. Raw cranberries are intensely tart and bitter, so the industry pumps them full of refined sugar or corn syrup to make them palatable. This is a disaster. High sugar intake causes inflammation that directly counteracts the anti-adhesive benefits of the cranberry. To eat a cranberry right, you must avoid the cranberry cocktail and sweetened dried versions. Instead, look for 100% pure, unsweetened juice, which you can dilute with sparkling water, or consume them whole in smoothies paired with naturally sweet fruits like apples or bananas to balance the tartness. Furthermore, many people ignore the skin. Like most berries, the skin of the cranberry contains nearly all of its uracilic acid and fiber. If you are drinking filtered juice without the pulp, you're losing half the medicine. Of course, even a protective superfood like the cranberry requires some caution. Because cranberries are high in oxalates, people with a history of calcium oxalate kidney stones should consume them in moderation. Additionally, cranberries can interact with blood-thinning medications like warfarin, potentially increasing the risk of bruising or bleeding. Most importantly, because they are grown in bogs where water can be recycled, it is vital to choose organic cranberries to ensure they haven't absorbed synthetic pesticides or heavy metals from the environment. Selecting a superior nutrient-dense cranberry is a game of the bounce test. In fact, historically, cranberries were known as bounceberries. A high-quality, fresh cranberry is full of air pockets and firm cellular walls. If you drop one on a hard surface, a healthy medicinal berry will actually bounce. If it simply thuds and stays flat, it's old, soft, and its antioxidant potency has faded. Look for a deep, opaque red. The darker the red, the higher the concentration of those life-saving PACs. Avoid berries that look pale, shriveled, or have moisture at the bottom of the back. Once you have your perfect cranberries, storage is exceptionally easy because they're built to last. Fresh cranberries can stay potent in your refrigerator for up to 2 months, or they can be frozen for over a year without losing their A-type packs. In fact, freezing can actually help break down the tough cell walls, making the nutrients more accessible when you blend them. By choosing the unsweetened whole fruit and respecting its tart power, you're turning a holiday side dish into a year-round biological shield. Stop treating the cranberry as a sugar-filled treat and start treating it as the anti-adhesion powerhouse it truly is. Your bladder, your heart, and your teeth will thank you.